We go hide away in daylight. We go undercover, wait out the sun. Got a secret side in plain sight. Where the streets are empty, that's where we run. Everyday people do everyday things, but I can't be one of them. I know you hear me now. We are a different kind. We can do anything. We could be heroes. We could be heroes. Me and you. We could be heroes. We could be heroes. Me and you. We could be.
Right now it's time to get the Anini brothers on stage. I don't see them. Okay, they're here. I'm very excited to welcome to the stage both Andrea and Alessandro Anini from Italy, from beautiful Italy, from Modena. I had the chance to visit you. We had together a course series done with the digital workflow. They both are the founders of the digital dental implant revolution. This is also your topic for today. And I think this course you did already a few years with us, a full digital workflow, was really amazing for me, besides the visit of the Ferrari Museum. And yeah, it's really a pleasure to welcome you to the stage. I'm very happy to welcome you. Yes!
Great, man.
Yes, good time.
So, thank you, Holger, for the kind introduction. Thank you to the three team for the invitation, for the kind invitation in this incredible venue. And we talk about?
We will talk about what is digital dentistry all about, and this actually it's going to be our first question. So actually it's my first question to you, Alessandro. What is digital dentistry all about?
Okay, digital dentistry is all about creating new digital workflows, smart.
He's mentioning technology basically perfectly blends with what is the pandemic strategy.
It's incredible. The monolithic technology
workflow steps. We were at 15 steps, and if we combine technologies and materials, so
the
full
production phase.
And so basically we can summarize this digital implant workflow key points down to 7 steps. At this point we send the file to the lab, and then you see here the new scan body, the 3D touch, and we have the best fit down to 4. Sorry.
Yes, we cut 3 steps. So we want to make the workflow more efficient.
And thank you very much.
Thank you very much.
Thank you so much.
Thank you.
Andrea.
Saturday. You're more than welcome.
Let's do that.
Because we go to the Ferrari factory. First thing, we go to the Ferrari, so you're happy already. So you're already happy. Then whatever we show is fine.
And Pavarotti Museum.
And then we have a nice dinner at the Pavarotti Mansion. That's true.
And also in Bottura restaurant.
Yeah, now we are exaggerating.
With roots in restorative, iTero's versatile scanners are designed to streamline and enhance a range of digital workflows, like full arch rehabilitation. Dr. Andrea Annini and Dr. Alessandro Annini will demonstrate just how intuitive the digital workflow for full arch rehabilitation with implants can be. This patient came to see Doctors Andrea and Alessandro Annini with a failing upper jaw dentition due to chronic periodontal disease. The treatment approach they chose was a full arch rehabilitation supported by 6 implants. Scanning patients with the iTero scanner at the first appointment is quick, comfortable, and an excellent way to capture high-definition imagery before beginning treatment. For the full arch rehabilitation, the doctors began by creating an eye record prescription to scan the initial failing dentition opposing arch. Easy transfer of files to chairside and lab software. So once the doctors captured the scans, they were able to share them, along with the case analysis and diagnosis, directly with their lab to help them with case planning and surgical guide fabrication. After capturing patient images, the doctors coordinated with the lab. Lab technicians then used the DSD files as a foundation for the restorative design. First, they exported the SMILE simulation files to the... Now for surgery. Thanks to the iTero scanner's accurate a post-operative X-ray is recommended. Then, the doctors walk through post-op instructions with the patient before the next appointment a few months later. Once the patient was healed, the doctors checked for successful osseointegration and made sure the soft tissue looked healthy and stable. Then, the doctors created a restorative prescription for the outside the mouth. Great! Now back to the lab. For the final restoration, the lab fabricated a metal bar for the foundation. They also fabricated At the final appointment, the doctors checked with the patient rehabilitation with implants was completed, and routine care and monitoring of the patient's well-being were resumed. And that's just one example of how the iTero scanner is a versatile tool designed to help you simplify complex treatments, work seamlessly with your lab, and increase patient satisfaction. Which treatment will you tackle today?
אסתטיקה, שיקום וכמובן רפואת חניכיים. הכנס הוא הצלחה אדירה, מאות רופאים, מרצים מובילים.
שתמיד מגיעים לישראל בזכות
for us being invited here in this to this society. Our lecture was about the surgical veneer grafting, which is just one technique more to add in your clinical armamentarium.
Try to overbuilding the site, try to create a right root profile around the crown.
Great treatment, great hospitality, great crowd today during our lecture, so we're really humbled and honored to be here, and we look forward to come back soon.
Good afternoon, everyone, and welcome to our panel interview on digital technologies in everyday restorative dentistry. I'd like to welcome everyone and thank our panel members for joining us today. Dr. Andrea and Dr. Alessandro Agnini work in private practice in Modena and Sassuolo, Emilia.
First of all, in my opinion, that it's important to clarify or to underline.
You can do diagnosis, you can do diagnostic mock-ups, night guides. The mock-ups can be like then the blueprint for the final prosthetic rehabilitation. I think that paradoxically, the undergraduates now are advantaged if you compare them with the postgraduate student or with the actual clinician, because they start with that, like they can start with the traditional with the traditional impression. So actually, I wasn't expecting any congress such as big, with so well organized, with nice booth and everything. So I'm very well impressed. Okay, so I'm Andrea Agnini. I come from Italy. I'm one of the Agnini brothers. It has been a real pleasure for us being here lecturing about our protocol surgical veneer grafting. It's our first time here in Budapest. Unfortunately, we have to leave very soon, so we hope to come back here in a timely fashion so we can visit this beautiful city. Today we discussed about the surgical veneer grafting, which is one protocol that we published together with Team Atlanta, Maurice Salama, Eddie Salama, Henry Salama, and David Garber in the Journal of Cosmetic Dentistry last year, and is the technique which can implement successful aesthetic outcome of the immediate implantation in the anterior area. So basically it's a combination of bone grafting, connective tissue grafting together with immediate implant and provisionalization. The biggest take-home message is that there is not one technique which is better than the other. You need to have like a small technique in your clinical portfolio, if you can call it like this, to offer to that specific patient to increase the predictability and following the protocol in a strict way. So step by step, exactly as the author guidelines indicated in the articles. But I know that there are many a nice speaker also from Italy, like one of our friends, Guido Picciocchi, or some orthodontics doctor from Mexico, which I usually met like when we travel around worldwide in the lecture circuit. Actually, I wasn't expecting any congress such as big, with so well organized, with nice booth and everything, so I'm very well impressed, and as I said, we hope to come back.
Baby, this is what you came for. Lightning strikes every time she moves, and everybody's watching her, but she's looking at you.